Hi, everybody. This is Cindy Kennedy, and you are listening to another episode of Living with Lyme. I'm so pleased to tell you that I have Dr. Isaac Elias with us today. He's going to talk a lot about Lyme and his passion. He is one of the best integrative doctors. He's been doing that since probably the early 80s. He has founded a lot of supplements. He is also the creator of many protocols, and he is also here with us to talk about one of the most important things. I'm very passionate about it, and it is called galectin-3 inhibitors. A lot of people have no idea what it is. Dr. Isaac Elias is a very, very, very prominent person with mind body, and he's going to talk a little bit more about that today. But I don't want to get wordy here. To read more about himself as well as his accomplishments, please go to my website, www.livingwithlyme.us. I'm so honored. Dr. Isaac, welcome.
Thank you. Thank you so much for having me. It's a real pleasure.
Oh, this is so good.
Talk about this.
Yeah. Tell us a little bit about your background. I know, did you begin as an acupuncturist?
No, I'm a native of Israel.
Okay.
And I've been I grew up in different countries. My father was an engineer, so I grew up in Africa, Brazil, and Korea. So as a teenager, I was already exposed to holistic approaches, to Taekwondo, to yoga. And when I went to medical school, I already went to medical school, which is 6 years in Israel, knowing that I will be a holistic doctor.
Really?
Not knowing
That's
exactly
great.
what it's going to be, but knowing, and also I raised bees from a very young age, from the age 12, so it gave me a very deep connection with nature. The connection with bees and with nature as a beekeeper. From a very young age 12, I was already a beekeeper. So when I went to medical school, in the same time I was a yoga teacher, I learned shiatsu and I learned acupuncture 3 years. And then once I finished medical school in the late 80s, then I came to the United States to do a Master of Science in Chinese medicine. So I also have a license as a Chinese doctor. And I studied a very esoteric branch of Chinese medicine based on the Book of Difficult Questions that focuses on cancer, actually. And it's very, very sophisticated. Not many people have learned it. But in addition, I have a very deep influence from Tibetan Buddhism, where I trained in a disciplined way. And for 10 years, I would do half-day meditation retreat, half-day work. And for 20 years, I would go away for 2 to 3 months a year. And so I got to treat some of the greatest masters in Tibet, the most legendary ones. So I developed this deep esoteric understanding and experience with a strong scientific background. And at the same time, I'm highly involved with research. I have over 30 peer-reviewed papers. And I have a grant from the NIH for my project on apheresis. So I really combine different approaches. And one of my key, so you can see that on one end, I'm dealing with a very deep understanding of mind-body effects, not just talking about it, but living it. And at the same time, I'm a researcher. And my research focused from the mid-90s on galectin-3. And galectin-3 is one of the best kept secrets in town, despite the fact that it has over 8,000 published papers. So what is galectin-3?
Yeah, tell us.
Yeah.
And I'm gonna interrupt you briefly and tell you that this product that has been developed by you, it made the biggest difference for my inflammation, and it was probably a big breakthrough for me. So it is my crown jewel.
Great, thank you. So we'll talk about PectaSol, modified citrus pectin, of course, but we'll talk about how it's working.
Absolutely, yes.
Galectin-3 is what we call a carbohydrate binding protein. So this means it's a protein that binds sugars, different kind of sugars of carbohydrate. And it's used inside the cell for cell development, which is not so much our issue. And it's used in the cell surface and outside the cell, we thought originally for injury repair. So when we have injury, galectin-3 comes on board. But what we have learned over the time is that galectin-3 is actually a molecule called an alarmin. it sets up the alarm. And in this sense, I'm giving it a new term lately when I'm writing a book about it, and which hopefully will be out in a few months. And it's really a survival protein. It initiates the survival response from a metabolic point of view, not from a nervous system point of view. So from the nervous system point of view, we all know when we get scared, when we're under danger, sympathetic system kicks in, right? Either it's fear, we fight, or we flight, FFF, the 3 Fs. And this is an immediate effect. And then once the danger goes away, we can relax. The metabolic way is a little bit more tricky because once it sets its course, it cannot very easily go back to normal. So what it does is actually the galectin-3 starts, we can see, for example, in sepsis or in infections, it goes up in 20 minutes. 20 minutes, so quickly, we had no idea, before any interleukin, before anything. And then it sets up this deadly cascade of interleukin-6, interleukin-4, growth factors, TNF-alpha, NF-kappa beta. It starts all this inflammatory response. So really, we now recognize, especially integrative doctors and people who are in the field of integrative medicine, we recognize inflammation as a driving force for literally every chronic disease. But inflammation is really not the cause. Inflammation is the response to the survival drive. So when we address galectin-3, we are addressing inflammation at its core. And this is why when we look at diseases that are affected by galectin-3, Cindy, it's every single disease, from cancer to congestive heart failure, to chronic kidney disease, to cirrhosis of the liver, to pulmonary fibrosis, to stroke, to Alzheimer, to Parkinson, to inflammatory bowel disease, because this injury repair drives, it's like we have a big cut on the skin. Yeah, we will repair the cut, but what do we get? We get a scar. So the galectin-3 drives damage through inflammation and through scarring. And once the tissue gets scarred, it becomes dysfunctional. So we have studies a lot of studies, for example, in animal models, 20 studies in different heart disease, vascular disease, kidney, where damage is caused to the animal, either by diet or by surgical procedure. And when we give our modified citrus pectin, we get a reversal of the condition back to normal. So dramatic. And we are now seeing it also, of course, in people, in different areas. A lot of the research originally was on cancer, very dramatic results. But now we see it in many, many chronic conditions. And that's why, because galectin-3 can be affected by stressors, and we don't know when our next stressor is going to come, it's so important to address galectin-3 on a daily basis. If you looked at my charts, I specialize mainly in cancer. But since both my wife and 2 daughters used to have significant Lyme, I became a Lyme expert. And now they're all fully functional, 100%.
Oh, that's awesome.
Normal,
that's awesome.
And now I'm back more to cancer, but it's remarkable how important is addressing the issue of galectin-3.
Right. And I've gone to many functional medicine conferences, and really they're not paying attention to this. What can we do about that?
I think we have to put the word out. It's a little bit my life journey. And I'm usually a little bit ahead of the curve, which is a little bit of a lonely journey, because often you talk to yourself.
Do you have the angel on one side and the devil on the other side?
No, usually I just stay with the angel.
Oh, because my thing is like, okay, you're gonna and then the angel's like, come on now, you can be good about that, and then the devil pipes in again, and you have to try to make sure that you end with the angel, right?
Of course. I mean, it's an interesting journey. It's like they say often, first they ridicule you, then they fight you, and then they say it's self-evident. So now there are well over 50 published papers on PectaSol modified citrus pectin, including multi-center clinical trial on its benefits in prostate issues. So now everybody is joining. So there are grants from the NIH, there are multiple universities. We just finished a double-blind clinical trial on hypertension to see the effect on congestive heart failure in Harvard, MGH. So now it's much bigger than my journey, and that's a good place to be in. But I really think it's very important to put it out to the world, because this idea of addressing our survival urge is bigger than PectaSol-C modified citrus pectin. When we relax, when we meditate, when we breathe deep, we are addressing this survival drive.
You
So
know,
there was factors.
There was someone that spoke at Elias last year about modified citrus pectin.
Oh,
and
great.
Yeah, so that, you know, that gets to a lot of people,
yeah, it
for
does.
sure.
And if you brought, I'm just apologize, I want to close the window. That's because I live in nature, but there's somebody working around.
Oh, that always happens. I usually have people cutting the lawn.
If we talk about Lyme disease, for the doctors who are using PectaSol-C modified citrus pectin are seeing that whatever protocol they use, no matter what it is, if they are using antibiotics or they use just non-antibiotic therapies, the patient does better in a significant way and faster and without side effects. And the question is why? I mean, how is it possible? How can it do so many things? It sounds like that's our biggest issue. Is how do we tell people, the world, it enhances immunity. How does it do all of this? Because of the same basic mechanism. So what happens, galectin-3 shuts down the immune response. It binds, how is it possible? Galectin-3, and I should have had a picture here, which I usually have in a, but for some reason I left it. It's like an arm. So it's a protein that binds carbohydrate. I'm showing it. So it has an arm, and it has a place where it binds different sugars. Okay. So in these sugars, and based on what carbohydrates are bound here, either glycoprotein, glycolipids, or short, it will create a certain reaction in the body. So when it binds what we call a ligand, it will create a pentamer of 5 different arms. And one of them, for example, is a protein called CD45. And when it binds to CD45, it shuts down the immune response, no immune response. So of course, it's a great way for the infection to make sure that the cells around it excrete galectin-3, and they shut the immune response and they can survive, right? And we know how Lyme, how Borrelia evades the immune system. In the same way, we talk a lot about the biofilm, right? Well, the glycolipids, the oxidized lipids, that often have glucose, sugars attached to them, carbohydrate, bind to the carbohydrate and create this lattice formation, because every pentamer, every group of 5 attaches to each other and create a shield, a coating. The moment you give the modified citrus pectin and you break the coating falls away and you are exposing the infection to the immune system. But because we are reducing the inflammatory response, because some of these carbohydrates create an inflammatory response, you are getting a cleanup of the mess without the excessive damaging inflammatory response. So patient with gut problems, patient with joint pain, patient with memory issues, they'll tell you, no, it feels good, it feels good. It's one thing I can tolerate is the modified citrus pectin. And
so
this is the reason.
It reduces the inflammation, but it still allows the immune system to do what it's supposed to do.
Absolutely. In fact, it enhances the immune system. If you take T cells and you put galectin-3, you shut down all the excretion of cytokine. Now I'm quoting a study. If you add a galectin-3 blocker, the cytokine starts excreting all the immune enhancer that it's supposed to excrete. And the same thing, if you take blood of healthy volunteers and you give them modified citrus pectin, you get a dramatic spike in T cells, in NK cell activation, the natural killer cells, and in the activity of these cells, in their ability to fight. So we have to understand, just like we use it for survival, the infections also use it for survival. So they call galectin-3, for example, aggressive bacteria in the gut. They call galectin-3 and it helps them attach to the side of the intestine and penetrate into the body. And so that's why modified citrus pectin is such, we have a number of studies on PectaSol, some with the USDA, showing what a good prebiotic it is. because of this reason.
Because it's fiber, correct?
Yeah, but it's a very unique fiber because it has a side chain called rhamnogalacturonan 2. And for people who know mistletoe, the immune enhancing benefits of mistletoe come from rhamnogalacturonan 2. So 10% of PectaSol is rhamnogalacturonan 2, which we published with the USDA. Pretty amazing, right?
Well,
But
it is. And, you know, I'm thinking to myself, a lot of times people learn or come across something kind of by accident. I mean, how do you come across modified citrus pectin? I mean, where did that idea come from?
so the idea came initially from Professor Avram Raz from Wayne State in the early 90s. He's one of the main researchers on lectins. And now we collaborate. In fact, we just submitted a paper for publication together yesterday, a review of modified citrus pectin.
How
So it's
exciting.
an honor for me, to work with such a person who really is the pioneer in the field of lectins. Lectins are so popular. Well, he kind of started the journey in the late 80s. And he realized that modified citrus pectin has galacturonic acid that can bind to this site and neutralize the galectin-3. So the initial research was in prostate cancer, where they took animals, they created prostate cancer, aggressive one in their hips, and then after a few days, they started either water or modified citrus pectin. There was a dramatic decrease in metastasis. Now, if this was a drug, I always say it would be a multi-billion-dollar drug, but it's just a unique modification from the citrus fruit. But what we had to do is create an efficient production system, because modified citrus pectin is a generic term. And, because every pectin is modified when it's taken out of the peel. So really, people have to understand all the positive research is done on PectaSol. And of course, I'm a victim of borrowed science, when companies from different parts of the world, across the oceans, the west of California, take the advantage and put out products and call them modified citrus pectin. They are taking a ride on my research, despite the fact that I have the patent and that I discovered the use in inflammation, the use in fibrosis, the use in chelation of heavy metals, which we didn't talk about. So rhamnogalacturonan 2 chelates heavy metals. So we have proven in multiple published papers, including human trials and case reports, how effective is modified citrus pectin in selectively pulling positively charged heavy metals, lead, mercury, cadmium, uranium. We just published a paper. Okay, and we know the mechanism of action. So the beauty about this, it's not an accident. It's actually something which is known. So when I understand the mechanisms, I just kind of open my mind and say, okay, if that's a mechanism, it's going to work. For example, after the Chernobyl incident, they gave children pectins because the food had a lot of radioactive material, and they saw a dramatic decrease in radioactive readings. I said, okay, since our modified citrus pectin, PectaSol-C, gets absorbed into the bloodstream, if I give it to people, it will lower their heavy metals. And indeed, this was the case. I did it about over 20 years ago. So you can see the multiple effects, because all of them are part of insult on the body, right? The immune system is being challenged. We get toxins and heavy metals. And so what happens? This also relates to Lyme very much. So what happens when we are under crisis metabolically? When we are crisis under metabolically, we need to produce a lot of energy very quickly, right? And the fastest way to get energy is through burning sugars. And we don't care if it's not efficient. This is the difference between 100 meters running and running a marathon. So we go from aerobic normal mitochondrial function, where out of one glucose, we get 36 molecules of ATP, right? And we move to one glucose producing only 2 ATPs, but we can do it 10,000 times faster. The bottom line is that we get an area in the cell which is hypoxic, has no oxygen, has a lot of lactic acidity, and the cell gets damaged. And also we start shifting into abnormal metabolism and into more cancer, more inflammation, and more diabetes. Galectin-3 drives diabetes. It shuts down AMPK. All of this starts at the surface of the cell by insulin receptors being blocked and by a sense of like emergency inside the cell. So you can see, you can understand why it's so important for the Lyme patients, because many of them have metabolic dysfunction, right? Mitochondrial dysfunction. So when you give modified citrus pectin, you address it by having a membrane effect affecting the intracellular. And you balance it further by giving the active ingredient for magnolia, honokiol, because honokiol has the intracellular effect of balancing what we call mTOR1, the pathway that blocks the mitochondrial functions. So you want to block mTOR1. So honokiol will block mTOR1, will block AKT, will block HIF, will reduce inflammation. So it will have a beneficial anti-inflammatory effect on the normal cell, and will have an oxidative effect, killing effect on all kinds of infections.
I have to ask a quick question here. mTOR, and we can actually look at mTOR, people's independent, if they have variants in their mTOR genes. Okay. Now, I do understand that mTOR does have some effects on cancer. Is that correct?
Huge effect.
Yes. So it's a negative type of effect.
Absolutely. And again, I apologize, I don't have my favorite diagram here, but basically, if you have a cell, try to do it, and inside you have like the mitochondria, and you want to produce energy in the mitochondria. So the sugars is broken into pyruvate, which is a 3 carbohydrate. Glucose is 6, so 1 glucose gets us to 2 pyruvate. And in the way you already produce 2 ATPs. You either put it into the mitochondria and you end up with 36 from 2 pyruvates, or the mitochondria is blocked, the Krebs cycle is blocked, and you go and produce lactic acid and right, okay. So this enzyme who does this is called PDH. Pyruvate and oxaloacetate come together, and this enzyme activates the cycle that produces energy. So while this is going inside, there's an enzyme in the middle that blocks it. It's called PDK, pyruvate dehydrogenase kinase. And this enzyme is supposed to be shut down so the cells work normally, unless we go into a crisis, where even in the presence of oxygen, the mitochondria is shut down. That's what happened in cancer. How the cancer does it? By activating this mTOR1 complex that activates this enzyme. And mTOR1 complex is activated by a mutation in P53, which is a gene suppressor for cancer. And by it goes down, it doesn't protect the cell. And by activating a pathway called AKT and HIF, and by blocking something called AMPK. That's why people take metformin. Metformin will activate AMPK and indirectly will affect mTOR1. So of course, when mTOR1 is activated, you get a shutdown of the mitochondria. The cells goes into this crisis, and then it starts proliferating because there's not enough oxygen, so it gets more blood supply. So it gets this environment which the body cannot control anymore because it can't. We have the galectin-3 shield, no oxygen, and the cells start replicating. And if you take honokiol and you block the mTOR1, you allow the cell to go back to normal. And you also expose the mitochondria, so conventional therapy that tries to create an oxidative burst by creating radical oxygen species, ROS, can kill the cancer cell. That's why honokiol with MCP are synergistic literally with every cancer treatment. But the king of all of it is blocking the galectin-3.
That's quite amazing. Is there any one particular type of person who is not a candidate to take modified citrus pectin?
I like to say anybody that is breathing should take MCP, and I'm not exaggerating, even children. So the dosing is important. Our clinical trials were on a full dose of 15 grams a day. Now it's very easy. It's come in a scoop. There's either regular powder or lime taste, or you can get it. There are some chewables for children, which have 1.2 grams, so children can take 2 of them twice a day. not enough for adults, but can supplement. And you can mix it with water. And you have to just take it like 10, 15 minutes before eating, so it's easy. So the formal dose is 15 grams.
So I have capsules though.
Yeah. Oh, yeah. So capsule you take nine twice a day or 6 3 times a day, but you can also get powders, of course.
Yeah.
You have it on your website, right?
I do. People can go to www.pursuewellness.us, go to the store page, and you can open up your own Fullscript account. And we do discount. We want to help everybody. So yeah, go right ahead and go there, hit the store page and open up your Fullscript account. We love it.
Yeah, in Fullscript you can get the different ones. So what happened? So we were recommending for maintenance only 5 grams a day. And but I'm really right now encouraging people to actually take the full dose.
And what is that? How many grams is that again? Does it add up to?
The maintenance dose is 5 grams a day.
5 grams.
And the active dose is 15 grams a day.
Yeah. Yeah, that's a lot of capsules. You know.
Yeah, but if you do it in powder, and it's great. And you can mix it with medicinal mushrooms. You can mix it with greens even. It's easy.
Yeah, so you can put it in your smoothie, right?
Yeah. Ideally, you take a little bit before, but yeah, you can put it with smoothie. It's not a problem.
Yeah. And you said it's a lime flavor?
There is a lime flavor, and it's flavored with stevia, which, for example, for Lyme disease is good. And there is just with no flavor, and then there are capsules, and then there is chewable. There are different ways of taking it.
Wow.
But when you will notice, it's not immediate because it takes time.
Yeah.
But you start noticing, wow, my joints are not as painful. My thinking is clearer, you know. I can exercise and like my cardiovascular function is better.
Yeah, there's quicker recovery too.
Your hemoglobin A1C, I know for myself, I was stuck at the same number. I didn't change anything. In fact, I went through traveling, gained a little bit of weight. So I actually thought it would go up. It was 5.8. This is when because of an eye surgery, I went to a full dose of 15 grams a day. I did my hemoglobin A1C for the first time in 10 years. It's down to 5.4 and it's staying there. The only thing I changed, I went up on modified cytospectin to 15 grams a day.
Yeah.
So it has this longevity effect. When we look at, there's an amazing study on centenarians showing that centenarians, people average age 101 to 104, compared to people between the 70s and 80s, which include a few centenarians. Some of these will make it, right? The 70 to 80 have an average much higher levels of galectin-3 than the people who are 100 years old. And it goes up with age. Because of this repair that causes inflammation, degeneration, and damage. Yeah, so it's an incredible thing. So the very simple solution is using PectaSol. And in my research work, I'm developing a way to pull out inflammatory compound through therapeutic apheresis, where we take out the blood, similar to dialysis, but more complicated, and we separate the plasma and the cells, and we filter the plasma. So while I'm developing a column and doing research, now I'm focusing on sepsis and kidney disease, and later on cancer, I have a big center for apheresis using existing devices in my practice. It's remarkable what it does, not only for cancer patients, especially with conventional treatments, but we are seeing reversal of chronic kidney disease, reversal of congestive heart failure. I'm not talking about stopping it. I'm talking about reversal.
Really?
We had one case that was on dialysis, and now it doesn't need it anymore. Now, it doesn't happen on everybody, but we understand the mechanism. As long as it's still inflammation and the fibrotic process is going on, we can reverse it. And this will be the wave of the future.
I think you said to me it's kind of a little bit more important than actually using vitamin C, right?
In many levels it is, because we get vitamin C through the food, you know. I mean, it's nice. Not telling you not to take vitamin C, but if there is something that is directly related to longevity, is blocking the damage of galectin-3.
Someone asked me the other day about that she's very, very histamine intolerant. Is there any concern with the modified citrus pectin?
No. In fact, if she has like, you know, hypersensitivity to histamine, it may actually help her because it will reduce the allergic response. So the allergic response is also a survival response.
That's
So while we
great.
do this, we also look at things like meditation and healing and sleep and hydration. Hydration is very important because if we look at galectin-3, galectin-3 creates a communication system, but you don't want it to start separating certain tissues. So if we look at our body, we are truly a miracle. We are 50 trillion cells, or 40, doesn't matter.
A lot.
Work in concert, 50 trillion, not billion. So 50 million times 1,000 times 1,000. That's how many cells. And they all work together. Each of them have different cells, right? I'm looking with my eyes, I'm smelling, I'm talking, my hair is different. But all these cells started from the same 8 cells that came out of an act of love. Out of love, 2 people came together and they created this expression of love. And these cells who know this contain all the information. Our information of all of our ancestors, and the psychological traumas, diseases of others through epigenetic. And now we express ourselves as this amazing miracle that in the same time also has to manage with our microbiome, which is even more genetic material. So there's actually, scientifically, a wave, an energetic wave of messaging that tells all the body how to function together. Because if it won't, for 10 seconds, if it will be mismatched, will break into pieces. And what really holds us together is the love and compassion between every cell, which is controlled by the heart. Because the heart is the only organ in the body who is willing to take dirty blood, all the difficulties, suffering, byproduct waste from all the body. It connects with the universe, and it then offers its clean blood to the body without questions.
That
While
is
it nourishes
wonderful.
itself. It's amazing.
It is. I have to ask about detoxification and if there's a role for modified citrus pectin in that. I mean, we're riddled with glyphosate in this country.
Critical. So the reason why it's critical, and that's why I started giving this image.
Are you sure you're not Italian? You talk really a lot with your hands.
No, I'm Israeli. And I try to express myself.
Well, they do say that we're really, if we're not, of the Jewish ancestry, that we're all kind of Italian, so we're kind of mixed together. Okay.
Especially in New York.
That's true.
So if we look at this, so when a certain group of cells decide to isolate itself, not to be part of the group, is because they go into survival mode and they think, I need to survive. Because the cell understands it does its work, it will end its life, and another cell will come. It's part of the big picture. Beehives are the same. The bee is part of a beehive. Interesting. So when a cell isolates itself, what do we get? We get cancer, a cell that doesn't listen to the body. Or we get a fatty tissue that is full of toxin that is holding itself. Or we get trauma stored at a certain place. And then that's where the toxins are stored. They are sealed from the body, so the body doesn't feel the toxicity, right? And one day we wake up with autoimmune disease, with cancer. Well, it didn't happen overnight. It was cooking at a certain place. In order to detoxify, we have to expose the tissue. And that's why modified citrus pectin is the most important supplement to take during detox. Why? It exposes the issue by breaking the biofilm. It binds to the toxins, to heavy metals, right? We know this, well published. It allows the body to bring oxygen and nourishment because there's no longer discovered by galectin-3. It allows the immune system to respond properly. It takes out the heavy metals from the body. We know that the excretion increases of heavy metals. And it prevents the chronic inflammatory response of toxins when we detoxify, so you don't get all this damage of secondary to hyperinflammation because of detoxification. So MCP is critical. And what I described with the heart is really part of the detox cycle. When I do retreats, I teach about it, about every organ has a different role in the process.
What about your other product, Pectacle Clear? What's the difference?
So Pectacle Clear is a combination of modified citrus pectin and alginates. And both of them are part of what we call polyuronides. It's a special structure that is similar, and both of them have the ability to bind heavy metals and toxins, but they have a little bit of a different profile. Also, the polyuronide in the alginate, because the molecular weight is a little bit higher, will bind the toxins, including mold toxins. For example, when you want to clean a toxic swamp in nature, you put in alginates. They will eat up the toxins. So when you take the alginates, it will actually bind to the heavy metals and toxins in the gut and will prevent the absorption.
Should you take both products?
If you have a specific need with detoxification, then you can take the Pectacle Clear, but take it together with PectaSol. So still get to the full dose, but take the Pectacle Clear 3 capsules twice a day. Yes.
Okay.
So it's a wider profile.
So outside of these two products, what else are you working on?
Well, modified citrus pectin is really, right now we are researching it in cancer, prostate cancer, in multi-center trial. We presented the data at ASCO in an abstract. We have 75% response. We are researching it in congestive heart failure, in kidney disease, in sepsis, in so many. But in addition, we have a very unique medicinal mushroom product called the Mycophyto or Mushroom Immune Max, where we grow the mushroom on immune-enhancing herbs. So we are the only ones who do it. And it has a remarkable effect on the immune system. I am the number one testimonial. I take it every day. And when I feel like I'm getting a cold, I will take a very high dose. And I haven't had a flu for 20 years.
Oh, you gotta cross your fingers. You gotta clear the air with that, because I don't want that to happen.
I feel like I'm getting sick, even on a flight.
Yeah.
I'll take tons of it. I'll take 30, 40 capsules and it will go away.
It's remarkable.
That's a very important product that we have. And we're now working on a specific product for removal of glyphosate.
Oh, so something separate from what we were talking about.
And also for removal of negatively charged metals like bromide and fluoride.
Okay.
This product will combine together with the PectaSol and the Pectacle Clear, so it will round up everything. Yeah.
People are worried about dementias and all being caused by aluminum. Is there a role for any of your products with that?
Yeah. PectaSol, the Alzheimer plaque has 10 to 20% more galectin-3 than normal brain tissue. 10 to 20 times, not 10 to 20%, times. And modified citrus pectin binds to aluminum, because aluminum is a positively charged heavy metals, of course. So it will remove aluminum.
Okay, that's...
And we have shown it. We actually shown it in studies.
Okay. And somebody has the capsules and it's on their counter or in their medicine cabinet, and they're not taking it because they're sick of taking things. Can they take those capsules and just open them up and put them in some liquid?
Of course. Or they can just get the powder.
I know. But I'm just saying, if they have it and they're not using it.
Of course. And we have to remember, even 5 grams a day is useful.
It is.
Definitely.
And
it's classical. Once you feel better, and then 5 grams a day are very beneficial.
So can you take it all at once, or it's real important to spread it out?
If you take 5 grams at once, of course, up to 7.5 grams. But if you take the full dose, take it in 2 or 3 divided dosages. Okay.
Definitely. And we're thinking about taking anything in our mouth and it's going into our gut. Is there any impact on our microbiome because we're adding
it's a good question. So sometimes, because of the initial adjustment, you will have some flatulence a little bit until some gas until you get adjusted. But we have at least 4 published papers. PectaSol-C is a powerful prebiotic. It benefits the microbiome. We have shown it. It makes, for example, it makes antibiotics work better. It has the ability to help address resistant bacteria. It has a lot of benefit. It's well published.
Okay. So, as a prebiotic, that actually is food, correct, for the good gut bacteria.
Exactly. And we will be coming shortly with an amazing drink, a probiotic drink that I actually bring from Europe for years, and now we are bringing it into United States. That will be enhanced. We will add modified citrus pectin, pecticle oligosaccharide into the mixture. It's grown on herbs, and I've never seen such a probiotic because it's full of life. It's made biodynamically with like crystal clear water from a fountain in Europe, and you feel the difference in your gut. So for people who want to address these issues, I have them mix the PectaSol-C inside this probiotic. And once it's available, I mean, we don't have the exact name for it, but it should be out in about 3-4 months.
Oh,
Very excited about it.
Maybe you could call it, something like the Kennedy mixture.
I like it.
I'm glad you like it. Yeah, I mean, people really want something easy and convenient, and again, Lyme patients are taking every supplement under the sun, and they're always after that quick fix, and people have just been sick for so long.
What you find when you take modified citrus pectin is that everything you do works better. Everything you do works better. It's because it's not only what it does by itself, it activates so many other things. So your supplements work better, your medications work better. Even people who are on statin drugs, some statin drugs, not that I prescribe them, don't work because of galectin-3. You take modified citrus pectin, they will work better.
One of the things that I'm thinking about, and I want people to know that there's a lot of different modified citrus pectins, on the market, and certainly you could pick one up many places, but your product is based on your science and your results. And so is there another reason why people should really stick with your product?
Yeah, the main thing is the structure. It has a unique structure that was proven. I don't want to tell you what kind of pectins we find in jars that are called modified citrus pectin. And we have a reproducible process. So when you hear about all these benefits, they are attached specifically to our modified citrus pectin, to a certain molecular weight, 3 to 13 kilodalton, to a certain structure, to a certain three-dimensional folding of it. And so, we have a very accurate enzymatic process, not just changing of pH. So we know, and we neutralize the enzymes with heat, with pH changes. And we've been at it now for 25 years.
Yeah.
And really the best hidden secret still. I mean, I know that I've added thousands of years of life, possibly tens of thousands of years of life with this work, because we have patients, for example, in our clinical trial in Israel on biochemical relapse of prostate cancer, where it stopped the process now for 4 or 5 years.
I'm so excited.
About 4 or 5 years,
Well, so, it means a lot. It means a lot. And I'm just thinking of someone that I know that really is not doing well at all from a cancer diagnosis. Is there any time in this diagnosis and treatment that, it's not, you shouldn't even bother giving it a go?
Well, and first, of course, somebody with cancer has to be under medical care. So, but in general, we have shown that modified citrus pectin is beneficial with surgery, because it speeds the healing. With radiation, it enhances radiation and lowers the side effect. With multiple kinds of chemotherapy. And now even with immunotherapy, with PD-L1 inhibitors. So we have the mechanism, we have small cases published, and we're now pursuing larger clinical trials. Very exciting.
And, there's a lot of impact from people studying their genetics. Is there anything specific in terms of people's genetic variances out of, we just talked about mTOR, but is there any other impact PectaSol-C can have on genetic variances?
Well, I haven't studied how it changes, but genetic variance is very important to understand that with epigenetics, we really have the power to change expression. So nothing is set in stone. When we look at genetics, we're just moving one deeper functionally, but let's not get fixated on genetic. Fixation is the hallmark of survival, not letting go. It's just one more piece. Everything is possible. When I teach meditation, I tell people, not everybody is going to be a miracle, but everybody can be a miracle. Why? Because we have a choice. And we have a choice if we let go. And the genetic expression, I think that the whole new genetic testing and epigenetic pathways are shedding a light on this amazing thing. So galectin-3 is controlled epigenetically. So stressors, even from our parents, will affect what happens to us now. And
with your experience with meditation and that mind-body connection, I think I have the most trouble encouraging people to take that step in their life because they either are hesitant, they feel they don't have time, or they're not really true believers. Give me some words, give me some advice that I can tell my people, hey, this is really important.
Well, I'll tell you, believers is great. Seeing it is believing. I teach large retreats in Israel, about 150, 200 people that I do on a volunteer. I always teach on a volunteer basis. And it's remarkable what happened after 3 days. But it's a question of priorities. Now, what is a good advantage? We live in a very inflamed time because we move very fast. And heat, inflammation, causes speed. It's a physical compound. When you heat molecules, they move faster. This means that we don't need a lot of slowing down to feel a difference. So 500 years ago in the Himalaya, where everything was slow anyway, you had to go on a 3-month meditation retreat to feel a difference. Now we take half an hour, go to a yoga class, we feel a difference, right? So that's the good news. Give yourself, sometimes I take people where only one whole day process and they come out different, especially doctors. And so that's really my passion, because the idea is to give people the tools to change their own life and to change the life of people around them. We are all connected. We live in an age of isolation, geopolitically, right? Nationalism. If you look at the survival model, it's a survival response, right? So it cannot work. I don't mean it doesn't work politically. Forget about it. It doesn't matter what your political views. It cannot work physiologically. It has to collapse.
Right.
Isolation never work.
Yeah, and
otherwise
stress.
We won't be alive.
Yeah, stress leads to a lot of changes in the body, and that is a problem. When I introduce the idea of mindfulness, I just suggest to people 3 times a day to just stop, whether they're sitting, lying, standing, have the ability to stop for literally a minute.
Right.
And take breaths in and out of your nose and just focus on the here and now. Where are you? What do you see? What do you taste? What do you hear? What do you smell? And it was so cute because one of my patients said, well, how long is that going to take? And I go, well, 3 deep breaths don't take that long. And if you can just spend that minute about 3 times a day, you're going to be introduced into that feeling of moving your body from that stress, that sympathetic to your parasympathetic.
And this is why mindfulness is so popular, because it introduces very simple things. Mindfulness is like the basis. And then when you move on in meditation, you have to let go of mindfulness even. But that's much more complicated.
It is.
But in the beginning, mindfulness is so important because it slows us down. We get space between our thoughts. Well, stuff comes out, emotions, traumas, feelings. We need to let go of them. This is a detoxification process. This happens on a membrane level. This happens on a capillary level. This happens on a physiological level. You see, all is tied together. Galectin-3 is a physiological expression, the biochemical expression. open heart, love, and compassion is the spiritual aspect. But they actually work together. Patient with congestive heart failure who have galectin-3 under 17.8, their heart is not working well, 12% will die in 1 year. If their galectin-3 is over 25.6, 37% will die in 1 year. Galectin-3 is most deadly to the heart.
It is.
Because
Okay.
it doesn't allow this communication. It doesn't allow this mutual support.
Okay.
Beautiful.
Yeah. Did we forget anything?
No, I think it's good. I think the most important message is really add modified citrospect into your regimen. I can't understand why. I mean, every holistic doctor, they really, I mean, I guess I have to put the word out that I understand it's fundamental to any treatment. If you have to choose between modified citrospectin and your fish oil, there's no question about it. There are questions about all different oils. Modified citrospectin comes much before fish oils. Really, it's fundamental to our health.
Do we have to worry if modified citrus pectin, does it have to be organic or labeled as organic?
No.
No. So it really is the inner coating of a citrus fruit?
Right.
Yeah,
But
it's not.
But it's modified in a unique way.
Okay. All right. All right. Well,
Great.
this has
great.
been great. This has
Thank
been
you so
great.
much.
Oh, are you kidding me? When this comes out, I'm sending it specifically via email to all of my contacts that are medical providers,
Great.
because I just think they need to hear about it, and they really need to, you know, put it in their protocols. It's not that hard.
Not at all.
No.
You can mix it. Great.
Yeah. Yeah.
This was wonderful.
Thank
you so much for
Thank you. And
Take care. Bye.
Oh, bye, everybody. This has been Cindy Kennedy with another episode of Living with Lyme. Come back. Do follow me at www.livingwithlyme.us. Get some free recipes. It's always good to have something good to eat. Thank you, everybody.